Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry, with this week's version of Dental Health with Dr. C. Last week we talked about smile design and the way you can structure a smile so it looks normal and healthy and natural to sit in your particular situation. So one of the things we like to do is get a lot of input because it's really making the patient happy and meeting their expectations that's important. So there's a certain number of steps we always do before we ever touch a tooth or change it whatsoever or numb the patient up. And these involve very simple steps. We evaluate the smile, take a lot of photos, but one of the important part is to get a lot of input from the patient. And if you plan this on the front side, you're not disappointed on the back side. So one of the tricks I've used through the years is something called the Smile Library. And this is an example of the Smile Library that I use in the office. Now the key to this is if the teeth themselves follow the golden proportions, they always look good given the patient's age, sex, and personality. So all of the teeth that I'm going to show you, all of these veneers, actually fit those guidelines. The proportions are correct. But by making subtle changes in the porcelain, we can really individualize them for that particular individual. So I have the Smile Library, and this is actually the same person you're going to see on every one of these shots. And these veneers were tried on with water, a photo was taken, they were taken off and swapped around. And you'll see if you look hard that very subtle changes can really change the look of the entire smile. So this is a very common starting place. This is softened and this looks good in a man or a woman. The front teeth have little rounded edges, the canines are a little bit round. But if you make the laterals just a little bit shorter, it tends to look a little bit younger and a little bit more feminine. So the other four teeth are exactly the same, but it has a little bit different look to it. Now if you take that same look and leave the canines a little pointed, it looks a little bit more youthful, like they haven't used the canines enough to flatten them down yet. I don't really have too many people that are asking me for that particular type of canine. Now, if you add just the smallest amount of porcelain on the corners of the canines, right there, it looks more masculine. You can't use that particular shape on a woman, frankly. But if I have a 38-year-old attorney with a baby face that wants to do corporate law, this is what I'm advising, frankly. Now, as we get older, things wear down. So when we're really young, things can be really round. Now in this case, Cameron Diaz would have to be in her cheerleading outfit at 14 to have something that's this round and soft and fluffy and sexy. But if I put that in the attorney, we'd have big problems. Now as we get older, the teeth tend to flatten out a little bit, which again looks normal. So if I have a 65-year-old guy that runs board meetings and spends his day chomping on cigars in people's butts, this is a fantastic look. This looks excellent for that individual. Again, we can play with the colors to make it look younger and healthier. We have all the proportions correct. And the important part is that we've designed the smile with the patient in mind. So, if you're looking for some smile enhancement, you really need to think about what you're looking for. Bring in pictures out of a newspaper. Bring anything you want. But the important thing is that you have to communicate or have the dentist communicate with you as to your desires, needs, and ultimate final results to fit your personality. So, that's this week's edition with Dental Health with Dr. C. If I can be of any help, give me a call. Visit my website, www.drpaulcoleman.com. Thank you.